No surprise to see all these injuries, especially in a sport with as much contact as football. We're joined now by concussion specialist Dr. Richard Figler, director of the Concussion Center with the Cleveland Clinic. Thanks for joining us, doctor. Obviously, football is very physical. What are some of the biggest causes of concussions for players?
So one of the things that we have seen over the course of the years, obviously, is gameplay, especially in the NFL. They did a study recently that showed that about 80% of the concussions that occur during games, and that's when most of the high impact hits really take place. The other thing that we've seen over the course of the years is that kickoffs account for a large percentage. The Ivy League actually just recently looked at this, and the NFL has made changes over the course of time, but 25% of concussions that occurred in the Ivy League actually happened during 6% of the plays, which are kickoffs. And so what they did is the NFL followed the NFL, moved the kickoff line up a little bit, and they followed that there was about a 68% decrease in the number of concussions over the course of that time period.
Wow. Now, I have to say, I mean, clearly this is a sneaky injury. What are some of the most common signs that really tell, if someone may or may not have a concussion? I mean, what are those long-term impacts you might expect to see?
So short-term immediate signs and symptoms that people have after a concussion when they get hit in the head: headaches, dizziness, fogginess, or kind of dazed and confused, light sensitivity, noise sensitivity. After those initial symptoms, we find that people develop disordered sleep patterns. There's a lot of mental health issues that we're seeing with concussions as well.
Yeah.
A lot of people that may be a little bit predisposed based on family history to mental health illnesses like anxiety or depression. When they do get a concussion, we find that sometimes they can morph into more of a serious depression and anxiety state, and we get them the appropriate mental health counseling that they need.
Now, you mentioned, the NFL and other professional leagues really, trying to make changes to combat this. But what about our youth, our kids, who are playing high school and just, youth sports? Is there anything changing there, and kind of what can parents kind of do to protect them?
It's a great question, and that's been part of the push over the course of the years is try to make sports safer. The rules changes have gone a long way. The referees calling illegal hits, athletes being taught at a very young age how to appropriately tackle, not leading with their head, but making sure that they do arm tackles to not expose their head to more injuries. But by far and away, the biggest thing that has been shown to help out is education and repetitive education. And that repetitive education starts at a young age, the signs and symptoms to look out for when some athletes are hit. And it's not just the athlete that needs to look out for that, but it's their teammate to recognize those symptoms to pull the athlete off the field. And a recent study showed that repetitive education does help, but probably more importantly is the coaches being supportive of the athlete to report those symptoms, because the athlete's fear of reporting those symptoms that they're going to get pulled out, they're going to miss a lot of time, they're going to let their teammates down. So that education has been really, really paramount in decreasing the severity of concussions, because we know that when the athletes get pulled off sooner, they get better faster.
Definitely takes a village here. Thank you so much, Dr. Figler. I appreciate you.
You're welcome. Thanks for having me.
Thanks. All right, now.